Welcome to the Barrier Breakdown, Disrupting Mental Health podcast, where we talk about the clinical and practical issues that face those working in the mental health industry.
Hello, everyone. Welcome to the Barrier Breakdown, Disrupting Mental Health. My name is Erin Molyneux-Bailey. I'm the Chief Operating Officer at Cognitive Behavior Institute, and my co-host, Dr. Kevin Caridad, who is the CEO and owner at Cognitive Behavior Institute. Today, we are joined on our podcast to discuss mindfulness-based cognitive therapy for OCD with Dr. Fabrizio Didonna. He is an internationally known clinical psychologist, a professor at the Institute for Lifelong Learning of the University of Barcelona, a visiting professor at Shanghai Jiao Tong University, and scientific director of the one-year master program in mindfulness-based therapy in Italy. He is the developer of the therapeutic model, the author of the related manual, Mindfulness-Based Cognitive Therapy for Obsessive Compulsive Disorder, and he's been practicing and teaching meditation for many years, and he gives his workshops and training retreats all around the world. So thank you so much for being here with us, Doctor. Can you introduce yourself to our listeners? Tell us a little bit about how you became interested in mindfulness.
Yes. Welcome and thank you for this kind invitation. I'm a clinical psychologist and also a father. These are my main jobs or missions in life. And I also, professionally speaking, the director of the International MBCT for OCD Center in Vicenza, Italy, where I am now in this moment. And I also teach as a adjunct professor at the University of Padua in clinical psychology. And I collaborate, as you anticipated before, with the University of Shanghai. I'm a visiting professor there, where I collaborate in several research projects about the effectiveness of the MBCT for OCD program. My background is basically in CBT, and my interest in mindfulness started at the end of the 90s when I began to meditate for myself and gradually started to introduce meditation in my clinical work with patients affected by severe disorders, admitted in an inpatient setting in the hospital, where I directed a specialized unit for depression and borderline personality disorders and also OCD for 25 years. Then I attended several trainings and retreats with John Kabat-Zinn in MBSR and with Zinda Segal, Mark Williams, and John Teasdale in MBCT for depression, and also with many others leading mindfulness-based teachers and authors. And then I started to share and discuss with these authors the possibility to adapt these mindfulness-based programs for obsessive compulsive disorder. So after about 10 years of trial and error, I was able to standardize and validate a final protocol, which is now illustrated in the MBCT for OCD manual published 2 years ago by Guilford Press.
Great. Tell us more about mindfulness-based cognitive therapy. What are the components of it? Tell us a little bit about your research.
Yeah. As I anticipated before, MBCT for OCD developed from the need to integrate what is currently most effective in treating this challenging condition, which is, as you know, CBT, with the principles and practices of Buddhist psychology, focusing not so much on the symptoms of the problem, but on the processes that intervene in activating and maintaining this clinical problem, which consists in particular in the relationship that people have with their private experience, with their internal experience. And what I noted in my long experience using mindfulness for OCD with probably hundreds of patients was that patients in general responded well to this kind of meditation practices and approach, and very often found a stable relief from their problems by changing their perspective and the relationship they had with their internal experience. And by internal experience, I mean thoughts, emotions, and physical sensations. This change in perspective is one of the main therapeutic factors or possibly the core element in these approaches. And also, what I found in my clinical experience is that mindfulness and self-compassion, because this is also an important component of this model, when rationally integrated with CBT, are probably the best approaches for this kind of problem, because they directly and deeply intervene toward the main cognitive biases or mechanisms that activate the OCD problems. Connecting with the Buddhist perspective, there is a wonderful quote from the Anguttara Nikaya, an ancient Buddhist text, that explains very clearly the sense of this changing in perspective that we want to develop through mindfulness to overcome OCD. And it says, not through actions, not through words, do we become free from mental contaminations, but by seeing and acknowledging them over and over. You know, this quote sums up in several ways the core meaning and principle of a mindfulness-based approach to OCD, because it is a sort of Buddhist therapy of OCD, because it highlights the importance to change in this disorder, not the contents of the problem, so obsessions and compulsion, but the relationship people have with their own internal experience.
How does this work, you think? You mentioned CBT. When you say CBT, is it interchangeable for you using ERP? Is that what you're referring to when you say CBT?
Yeah, actually, as I told you before, MBCT for OCD is an integration between CBT, the most affected parts of CBT, and the principles and the practices of mindfulness and self-compassion as well. And one of the most important practice or exercise that we provide in this model is the mindful exposure, which is an integration between ERP and the practice of mindfulness, which is quite different as a rational, but the aim is to allow patients to expose themselves to their reality as it is. It's not so much to expose to anxiety. This is not the aim, but the aim is to see reality as it is. So to see the objects and the events the way other people without OCD can see. Mm-hmm. So it is a different approach compared with ERP. And there is much less anxiety in this practice compared with the standard ERP. Okay.
What advice would you give to clinicians that are watching? If they kind of they treat OCD or new to OCD treatment, what advice would you give them in their approach to beginning to look at mindfulness-based cognitive therapy for OCD?
For our colleagues.
Correct.
What I asked myself in many years of working with OCD patients, what was not so much what worked with this disorder, which is quite clear in the experience of every clinician. But why what works today is not effective for more than 50% of patients with this disorder? This is the data that we know by research. For this reason, I began integrating CBT with the principles and practices that were proving effective for other problems, depression, anxiety disorder, and so on. So what I recommend to colleagues is to always ask yourself what more you can do to improve the effectiveness of your work, and which exercises, techniques, or skills can rationally be most useful for your patient beyond what you already know. This is one of the principles that guided me in developing the MBCT for OCD program.
And tell us a little bit about your book that you've published.
Yeah, the book is a treatment manual. It's a mindfulness-based cognitive therapy. It has been published by Guildford Press 2 years ago. And it is a complete manual in explaining the rationale of this model. So there is an important theoretical part that explain, in particular, what are the cognitive mechanisms that intervene in causing, activating, and maintaining OCD problems, and also explaining the way in which mindfulness and self-compassion can be really helpful to modify this cognitive mechanism. And then, of course, there is a part in which there is a description, a detailed description of the program, session by session, with all the transcripts of the exercise and practices we give to patients. And it is also included, the book also includes audio downloads of guided meditations that are part of each session of the program.
That sounds wonderful. I think it's very helpful to have the manuals, particularly as one's newer with a model, to really help guide. And I plan on getting several copies from my staff.
Absolutely.
Wonderful. And tell us a little bit about, so where can they order it online, or is it through a website that you have? Do you have any other books for published that are available? Anyone else who would like to read up on your research or anything of that nature?
Other book by me, or what?
Anywhere that people can find more material about your work, whether it be research, whether it be publications, or just to find you on the web to find out more about you. Where could we find you?
Yeah, okay. You can find more information about me, in particular in our official website, which is www.mbctforocd.com, which is in 3 languages, in particular in English, where people can find a lot of material about this model, about the manual, and also about the centers worldwide that provide this kind of treatment. We also offer the program online. This is a really interesting setting that we started to use, in particular over the last 2 years. And so we can offer very often the program to people very far from our center. This is a good option.
Yeah, the wonders of technology now that everyone is up to speed. I guess that's probably the only good thing that came out of COVID.
In particular after COVID, or because of the COVID pandemic.
Yes, exactly. Well, that's wonderful. I know at CBI, we'd love to kind of discuss with you a little bit offline about our continuing education, because dissemination of this type of practice is, what we stand for and what we encourage. So thank you so much for taking the time with us, Doctor. It was wonderful meeting you, and we hope to see you again soon.
It has been a great pleasure. Thank you to you.
You're welcome. And thanks so much to our listeners for this week's episode of The Barrier Breakdown. We will see y'all next week. We hope you stay safe and healthy. Take care.
Thanks for listening to The Barrier Breakdown, Disrupting Mental Health podcast. Check out our website at cbicenterforeducation.com for more information and to learn about upcoming continuing education events.